older people come into care, quite often we need to assess them for risk factors, like a risk for falling, risk for developing problems with the skin, like pressure ulcers and so on. Most facilities would have some kind of tool to assess different kinds of risks. So the first thing would be to determine whether the facility has a risk assessment for falls, a risk assessment for skin breakdown, and so on. There are also general screening tools for depression in aged care or older age, and all these tools can help facilitate that process. Where that does not exist, it would be very important that the assessment is done looking at how the person walks, and particularly finding out how they walk at home. Quite often the family will tell you whether they hold on to furniture to walk around, whether they use a stick or not, whether they need somebody's arm to go up and down stairs. It also helps to know whether they live in a ground floor house or unit or whether there are steps, and to find out if they have actually fallen at home. Because if they have, chances are that they will also fall coming into hospital. The other thing to remember is that for people who have some confusion, regardless of whether it's acute or chronic, coming into a new environment increases the risk that they would fall, so that it would be necessary for nurses to be aware that the person is at higher risk of falling simply because they're older and in a new environment.